It's Dave. Today we're going to talk about something that the majority of us will get at one time or another in our life, and that is athlete's foot. Yes, it can be embarrassing, especially if you like to go barefoot or wear flip-flops or sandals out in public. It's not something you want to have to deal with. However, it is treatable. It actually will start between the toes. It is a fungus, and what happens mainly is you will get in tight shoes or sweaty socks or wet socks. And between that heat and that moisture that occurs in there, it's a great place for fungus to thrive and survive and multiply. Itchy, scaly skin will appear. It can be painful and burning. It also is very odorous. So maybe your feet normally don't stink or just a little bit. If you actually get athlete's foot, those are the socks that mom says throw away, okay? It mainly occurs on the bottom of the foot. However, it can creep up the side and even go to the top of the foot. It can also affect your toenails as well. And it's very, very contagious, which means if you're scratching your feet or patting your feet, whatever you may be doing, and then you don't wash your hands, that's how things like jock itch happen. It's the same fungus, just on another area of the body. So you need to be very careful because it is so contagious. Now, what you can do as far as prevention with it, number one, you want to have dry socks. It may mean changing your socks 2 to 3 times a day, depending on if you're in sports, depending on if you're an outdoor laborer who's in the heat a lot, your feet get sweaty. You want to continually change those socks. You also want to alternate shoes because your shoes will become hot, sweaty, and wet as well. So you want to have different pairs of shoes for different days of the week to help out. If your shoes become wet, get a different pair of shoes. It's very important to do that. You don't want to share towels. I know that happens a lot, especially in big families, because of how contagious it is. If one of the kids gets it and you're sharing towels, likely more than one's going to get it. So be very aware of that. You want to wash your socks and your towels in hot water, separate from the other laundry. That will help take care of killing that fungus and not getting it into any of the other laundry where it can be transferred to other areas of the body. The other thing you want to do is protect your feet in public. In the summertime, you're going outside, maybe you go to the pool, maybe you're in school and you have group showers. You want to make sure you're protecting your feet. Wear flip-flops if you need to, deck shoes, things like that in the shower to keep them protected. And like I said, do not share towels. That's very important. You can put antifungal powder in the morning in your socks, in your shoes, and on your feet, especially if you're having a recurrent problem with athlete's foot. That would be a good idea for you. But it sure doesn't hurt to help keep things dry as far as that goes. Now, as far as treatment, what are some things that you can do? Well, if it is severe, there are prescription strength clotrimazole and miconazole, which are antifungal creams out there that you can try or you can get a prescription for. There's also topical steroid creams. Those should only be used for a short term and only for really bad cases. You can also get oral antifungals, ones you take by mouth, like fluconazole, itraconazole, or terbinafine. Terbinafine is also used for recurrent nail fungus as well. But honestly, the percentage of effectiveness on that one is about 50%. It does have a lot of side effects and can infect your liver. So you want to watch out for that. Have the discussion with your doctor or general practitioner on that. Now, there are some things you can do without going to the doctor. Of course, like I said, there's some prescription strength clotrimazole and miconazole, but there's also over-the-counter creams and ointments you can use as well. Clotrimazole, which is a generic for Lotrimin, is available over the counter. You use that twice a day. as well as Myconazole, which is Desenex. That's over the counter. Use that twice a day as well. Then there's Lamisil, which is terbinafine. That one is a once a day cream. That one is generally, you want to just stick to the feet on that one. The other two can be used as for jock itch as well if it spreads, but keep the Lamisil or the terbinafine on the feet only, okay? You can also use butenofine, which is the generic for Lotrimin Ultra. That one you also want to use twice a day for 7 days, then go to once a day thereafter. But you can start it out twice a day for 7 days. Tolnaftonate is another one you can use, which is generic Tinactin. That one is twice a day as well. Those are the over-the-counter ones. If you're not seeing any improvement after about 2 to 4 weeks, get in to see the doctor, see if there's something else that they can help you out with to try and clear it up. Also, if it's repetitive and it's coming back, you want to make sure you get in to see the doctor. Something that you can try that is a little bit homeopathic, which meaning it's more natural than the prescriptions. Actually, from a study in 2002, they showed that 50% solution of tea tree oil in water cleared 64% of the patients that had athlete's foot. So you just take that tea tree oil, mix it in a 1-to-1 ratio with water, and apply that twice a day. Again, if you're not seeing results within 2 to 4 weeks with that as well, get in to see your doctor. There are other options. The other thing is, if you happen to be a diabetic and it doesn't show any kind of results within 1 to 2 weeks, or if you have bleeding from any sores on your feet or cracks in the skin, immediately get in to see your doctor, because you're in a different situation. You don't want to end up losing a toe or even a foot over an infection that can occur, and when you could have went in to see the doctor to get this thing checked out and cleared up.